Hello everyone. Uh, Here's another part of the breastfeeding which I'll be dealing today is the factors which are all inhibiting the breastfeeding, as well as what all the measures you can overcome with that things. So let's talk about the factors which are hindering the breastfeed, as well as how to get rid of them. Fine, are you ready? Yes, okay. So the factors which I'll be talking about, in that the first one comes the psychological factor. So what do you mention when we are talking about the psychological part? Yes, obviously the stress, the anxiety, the tension, the depression, as well as other worries, and these all factors will affect the mother's how the letdown reflex of the mothers will be affected, and then the result will be like the babies won't be able to have the breastfeed properly. The breastfeeding injection or the milk will not be secreted properly, and when there's no there's no proper milk, the injection also will not be there. So it affects the baby's breastfeeding. The babies having the feed, how that by all these factors the letdown reflex of the mom is totally disturbed. And the letdown reflex I have already mentioned in the previous sessions, so this letdown reflex will be affected completely. Next factor is, before leaving to the next factor, the major you have to go through. What is your concern about the psychological factor towards the mom? That means you have to encourage as well as support the mom in every way possible. Make her relax, and let her be in a good comfortable position, and relieve her from every kind of anxiety, depression, or while breastfeeding the mom should be free of all kind of factors. Fine. Okay, the next, the factor which is inhibiting, which is disturbing the breastfeed, is the breast engorgement. What you understand by the hearing the word breast engorgement, that is the breast will be swelled up. The breast will not be in a normal the size. It will be swelled up. How? The some mothers, they feel a hardness, they feel like the painful breast, the tenderness over their breast. And if the mothers feel these things, how it occurs, like how this breast engorgement develops when the breastfeed is delayed, when the mothers do not breastfeed their babies on time, and when this what we say that the baby is not in a good latch or in a position, so the milk will not come out properly, and it will be stagnated inside the breasts, as well as the milk accumulates inside the alveoli. So when this is stuck stagnated inside the breast, the production gets increased, and the amount of milk in the breasts will be increased. It will exceed the capacity of the normal breast size. When it exceeds the breast size, then the mothers feel heaviness, they feel the hardness over the breast, and it leads to the painful breasts. Right? So when it is like this, the size of the breasts will be obviously increased. Now what you do is, you have to give some of the measures to the mothers. You have to explain some of the remedies which can be helpful to relieve from this kind of the problem. What will be the step? Early and frequent feeding is encouraged. Whenever the mom feels like dripping of milk, or whenever mom feels a bit heaviness, she has to feed the baby at early possible. Then the attachment that I mentioned in the previous session, good attachment, good latch should be maintained by encouraging mothers step by step process. And then after these things, local warm packs should be applied over the breasts. Like, it will relieve the breasts, it will relieve the tension, the heaviness, as well as it will relieve the pain from the breasts. And this shouldn't be exceeded more than 15 minutes. And this, you know, pain of this breast engorgement is released with the help of an analgesic called paracetamol. So this paracetamol can be given to the mother if the pain is not relieved yet, and as well as if baby is not getting breastfed, or the still excess amount of milk is in the breasts, you can go for the express milk. You can get the milk out with the help of expressing breastfeeding procedure, right? Okay. Then the next factor we'll be talking about is the flat and inverted nipples, the most common problems of the mothers, especially who are the primary gravitors. The mothers who are facing such kind of problems has to be encouraged to have such of the remedies which will help them out of this, right? And this flat and inverted nipple, in the when the nipples are flat, what will happen is baby won't be able to suck the milk from the nipples, and it's very difficult for the mom as well to help the baby feed. And the inverted nipples, the baby cannot pull the nipple outside of the breast, and as well as this inverted or the retracted nipple, which is completely not out of the breasts, it will make an attachment of the breasts very much difficult for the baby to have a good latch, as well as it will lead to the bad latch, as well as to the improper breastfeeding. These things should be diagnosed in the antenatal period itself. While examination, these should be diagnosed, and proper remedies, proper treatment should be done before the delivery occurs. And by the time delivery is completed, these nipples should be out for the ready breastfeed. And tell me, how do you get rid of, how do you get rid from these problems? How do you help mothers to have the problems solved? The stimulation is important, that continuous stimulation of the nipple, as it will, but with the help of stimulation, it will try to come out, as well as the manually stretching of the nipple. So manually, mother can stretch out the nipples with her own fingers, and stimulate nipple before feeding. It will be easy for mother, as the stimulation occurs, the nipple and the baby's mouth come into contact, and there comes a reflex, and which may help in protruding of that nipple. And pressing above with the thumb, and as well as the stretching, pressing above with the thumb and stretching with the fingers, it may help in this one, the normal nipples. And before putting the baby into the breast, these exercises should be maintained, and the baby should have a good latch before the breastfeed, right? Okay, the next problem, or the next factor which is hindering the breastfeed, is sore nipple. Sore nipple, it's caused by the incorrect attachment of the baby. Every problem which has a start with the bad or the poor attachment, everything is started by that. That's why it's important to maintain the good latch, to have a good attachment of the baby, which will lead to a successful breastfeeding. Okay, I was talking about the sore nipples. This is again caused by the incorrect attachment, as well as the baby who sucks only the nipple. Again, the paw attachment. So the baby will be he'll be sucking only the nipples, and he doesn't get enough milk from the nipple. He won't get enough milk, so he sucks the nipples vigorously, what will happen is it will be much painful for the mother, and it will lead to the soreness. And pain during feeding and fissuring, it may lead to the cracking of the nipples. The frequent washing with soap and water, again, if mom is doing such practice, and it will lead to the soreness again. And this one, the pulling of the baby while baby is having the milk, and suddenly they are pulling the baby outside, the breast, it will again lead to the soreness. What can be the majors now? The majors are like, first of all, correct the position. By correcting the position, baby should be in a good contact with the mother's breast, right? And hind milk should be applied. When the baby is completing the breast, the hind milk should be applied over the nipples. It will soften. It will, give a relax to the mom, and nipples should be allowed to heal between the feeds. When the baby is having a feed, then between the feeds, she should be allowed to, she should allow the nipples to be healed in between them. Got it? Okay. The next factor affecting the breastfeed is the breast abscess. What do you see by abscess? Infection or the pus collection? Right. Okay, the breast abscess is developed if the breasts, the problems which we have seen till now, if they are left untreated, or the engorged breasts are not healed completely, not given care completely, or the cracked nipples which are not taken care of, as well as if there is the blocked ducts, it may lead to the abscess. And if it gets collected inside only, and when you don't care for them, and it will it will be changed into an infectious process, and it will lead finally to an abscess, and there's no option left other than the incision, right? So the infection will be at the high risk, the fever will be, obviously the fever that continuous or the frequent fever episodes will be there, as well as the tenderness and pain over the breasts. Mothers feeling such things should directly go for the treatment. They should show themselves for the examination to the doctors and help relieve all that things. The majors in this will be the treatment, especially because it can't be relieved at home now. It can't be the healed by doing such simple things. Now the analgesics, antibiotics, as well as the incision or the drainage should be done in the hospital. And if only one breast is involved, then mother can continue feeding the baby with the other breasts. Right? Breastfeeding shouldn't be interrupted. It shouldn't be, stopped for the baby. By these things, you have to find out the problems as well as the measures which can solve these problems. Right? Got it? Okay. The next, we'll be moving to the barriers. So the barriers, the hindrances which are occurring or which are not leading to an effective breastfeeding is, like, you have to see whether there is any lack of confidence in the mother, right? If mother is not fully confident while breastfeeding the baby, so it may lead to the barrier. So there won't be an effective breastfeeding, right? Okay. Then some of the mothers, they believe that the breast milk is not sufficient for the baby, so they won't they won't continue with the breastfeed. They'll start the formulas, they'll start other foods in between, and the breastfeeding gets interrupted, and it will again not lead to a successful lactation. Then if there is not an adequate support for mother, because support is very important, whether emotionally, whether financially, whether other, like whatever the means are there for the mother, if that support is not there for the mother, what will happen is the breastfeeding won't go normally, it won't go successfully. The again, if there is any kind of the breast surgery, previous history of that, if there is any previous breast related problems, again the mother won't feel good to feed the baby by the breasts. She has that past experience. With the help of that, the breastfeeding will be suffered and the baby won't be fed by the breasts, right? Then the problems which I mentioned, the factors which I mentioned of the breasts, if any of the problems are leading, or if any of the problem is arising, then the mother again stops breastfeeding, and because of the problem, the mother thinks that now the breastfeeding is no more possible. The breastfeeding can't be done for the baby. This again affects the breastfeeding. The next is like, if the mother feels embarrassing, the mother feels like it's a shame, or it's a kind of like not good for me to breastfeed the baby, whether in the public, whether in the between the friends, between the family. This leads to the barrier. This leads to an what we say that an interruption between the baby and the mother, and the baby won't be given a proper breastfeeding. Fine. Then, if mother is having any serious diseases, if she is suffering from any kind of chronic illnesses, as well as if she has a postpartum depression, or she is suffering from any kind of psychosis, so these things may lead to the barriers. So they become the hindrances before, for the baby and between the mother. Right? And these things, if any of the things, any of the barriers are coming in between, the breastfeeding is no more possible. The breastfeeding for the baby is not going to happen. These barriers has to be overcome. Everything should be explained, everything should be managed and encouraged to the mother, so that these all things will go away. It will be overcome, it will be completely gone. Fine. Got my point? Okay. And in case of like breastfeeding, some of the mothers, or I can say the babies, they have certain problems. They have some of the issues where the mother cannot feed the baby, or the baby cannot have feeds. So what I mean is the contraindications. So contraindications of feeding were all the things I'll say for infants as well as for the mothers. So for infants, there can be a condition like galactosemia, right? Have you heard of this term galactosemia? No? Yes. Okay. This galactosemia, it means glucose in the blood. And it's a metabolic disorder in which what happens is the babies with this disorder, they won't be able to metabolize certain types of the sugar. For example, like galactose, it won't be metabolized in such babies with who are having this galactosemia. This galactosemia, which is usually found in the the basic milk like breast milk, it is found in the dairy products, as well as it's found in the cow's milk. And when it cannot be broken, because the body has to break down this galactose into the glucose form. When this galactose is not at all broken in the body because of this metabolic disorder, what will happen is it builds up in the tissues. This galactose will be built up in the tissues as well as in the blood. When it is increased in the blood in the higher amount, it will lead to a condition called as galactosemia. That means the glucose will be present in the blood, right, as well as in the tissues. And this condition, it contraindicates the baby for having this one breast milk, because the breast milk contains that galactose, and it has a lactose sugar is present in the breast milk. When again the baby will have a breastfeed, it will increase the sugar, it will increase the level of galactose in the body or in the blood of that baby, right? So baby will not be given the feed. The second condition the baby or the infants they have, that is phenylketonuria. generally called PKU, phenylketonuria. It's one of the birth defects of the infants. After the birth, it has to be detected immediately, and the process for the detection is that the blood is taken from the heel of the baby for checking the presence of this kind of enzyme, and this is caused by an amino acid which is called phenylalanine, right? And this phenylalanine is built up in the body. So this phenylalanine will be increased in the body due to the the enzyme which is used to pass away this phenylalanine is no more present in the body, and it will lead to the condition called phenylketonuria. Do you got my point? So these two conditions, or this is the condition where the infant won't be breastfed from the breasts, or the breastfed from the he is abstained from the breast milk, right? Okay, so now who? The mothers. The mothers who are for mothers, like the breastfeeding is not to be done, or the breastfeeding is not happening, is when the mother's condition is the infectious diseases mother is suffering, or infectious disease mother is involved in, such as cytomegalovirus, herpes virus, or HIV, human influenza virus, as well as if mother is actively in the tuberculosis. These such infections, if mother is facing, if mother is suffering, then this is not possible for the mother to feed the baby, right? The breastfeeding is not possible for the mother to, or we can say the mother cannot feed the baby at all. Fine. Okay. The other things, like if the drugs mother is on, like the mother is on any chemotherapeutic agents she is taking, or any radioisotope therapies she is under, or I can say if she is under the medicines like Primicune or the quinine, as well as she is on the sulfur drugs, if she is continuously taking such kind of therapies, if she is continuously taking such kind of drugs, then mother won't be allowed to feed the baby, that they may directly affect the baby's health. Contraindications, you understood? For the baby, the two conditions like galactosemia especially, as well as the phenylketonuria, and for the mother, the infectious agents like I mentioned, like a cytomegalovirus, herpes virus, human influenza virus, as well as the tuberculosis. And if she is under the drugs like chemotherapy agents, and she is any therapy like radioisotope therapies, as well as if she is under the sulfur drugs. These things has to be kept in mind while breastfeeding. The breastfeeding is, as I mentioned, that it is effective for both mother as well as the baby, but at the same time these things has to be kept in mind before feeding, that it shouldn't affect the baby, as well as the mother shouldn't be affected if any of the conditions arise. The treatment should be done when the mom is recovered from the treatment, or the medicines is over for the mother. Then after completion of that, within the week or after completion of the week, she can start the breastfeeding, right? Or if the mother is feeding the baby, then if she got any illness in between, she can discontinue the breastfeeding till she is over from this, and till she finished her medicines, then she can regain the breastfeeding. Then she can enjoy the breastfeeding again, and she can have her baby towards the breasts, right? Okay. Let's wrap it up by saying some of the important points. Why what we discussed in today's session is that the factors which are affecting the baby, as well as I mentioned some of the barriers which are coming in between an effective effective breastfeeding, as well as some of the contraindications that stop the breastfeeding for both mothers as well as for the baby. So this is it. See you in the next session. Till then, take care.